Generations of newborn babies like 2-day-old Chaya Rivka have been born in Bikor Cholim, the oldest hospital in Israel. The maternity ward is bustling in this crowded inner-city hospital in downtown Jerusalem, but it faces an uncertain future.
It's very important that there be certain hospitals, which are community hospitals, which are located in the community and can provide quality care to patients close to where they live, particularly when we're dealing with a lot of indigent patients.
Sitting on prime real estate, this historic institution is under pressure to shut its doors after serving the community of the Holy City for 187 years. This means the mainly poor, ultra-religious, and Arab residents of the older neighborhoods of the city will have to seek treatment in hospitals in the suburbs.
People don't have the physical ability to get to the other hospitals that are out in the periphery. In Jerusalem, geographically, those hospitals are about a 20-minute ride. And if somebody's life was in danger and they needed immediate help, realizing that the brain only has 6 minutes before it's too late, then 20 minutes is too late. It's just arriving dead on arrival.
Jerusalem several years back experienced a wave of terrorist bombings which further cemented the need for a hospital downtown.
This hospital stays in position in the middle of the town, where all the other hospitals are outside of the real center. So it should be one hospital, and there is no city in the world, large city like Jerusalem, that you can say that they don't have hospital in the middle of the town.
I picked Bikor Cholim because it's really close by to my house, and it wasn't such a long ride from the taxi to Bikor Cholim to have my baby, which was really nice.
Bikor Cholim Hospital is the oldest hospital in Israel, servicing 6,000 births a year. There are rumors flying of a deficit of $5 million. Not a lot of money. What's the real story as this baby's crying out? And will they be born over the next few months and years to come in this hospital? Doctors and nurses are proud to work at the hospital, but even they are wondering about their own future. I'm not sure that next month I'll get paid or not. It's important for me, and it's also a pity because this is a great place, very warm, a very intimate and pleasant hospital. It was very nice to work here, but because of all sorts of financial difficulties, I have decided to leave and have already found another place to work. The hospital runs on a $40 million turnover, and it's $5 million in debt. Dr. Pollack says they can't even raise donor money because of their uncertain future.
The lack of clarity as to the long-term future of the hospital disturbs us and prevents us from raising these donations. And that's why it's so important that we guarantee the long-term future of the hospital, and that the government has to come out with a statement saying that they're interested in the long-term future of the hospital in its current location. And I think from that, everything will flow.
The health ministry issued the following statement to the media line.
Bikor Cholim is a private hospital. The government is legally unable to come to its assistance. Nevertheless, the Deputy Minister of Health has declared his opposition to closing the hospital and has asked for the Prime Minister to intervene.
No one really knows why the funds are not being found to keep Bikor Cholim open.
So there are multiple issues here. There are real estate issues, there are issues of financing of other hospitals, but there are multiple forces that are much bigger than this hospital and much bigger than the workers in this hospital and then the patients in this hospital that are putting a squeeze on the hospital and trying to swallow it up.
In the 21st century, it is hard to financially maintain the viability of a hospital with only 200 beds. But if a solution isn't found soon, the only hospital in downtown Jerusalem will likely shut its doors.
And that's why we've really reached, to a certain extent, the end of the road, that there has to be a solution to the crisis here and now, because without a solution to the crisis, we're just going to have to close our operating rooms, close our delivery rooms, and then all the workers, whether or not they wanted to accept that pay cut, will have to go home.
From Bikor Cholim Hospital in Jerusalem, this is Felice Fritzen reporting for the Media Line.